Hi everybody, my name is Courtney and I'm a retail pharmacist in a metropolitan area, and today I want to talk to you about what to do if your doctor is not responding to your request for a prescription renewal. So this would be that your prescription ran out of refills and you are requesting that they send additional refills to your pharmacy. So this weekend I had a patient call to check on a prescription renewal request for their gabapentin that we had submitted to their doctor a little bit more than a week ago, and his doctor had not responded. So I asked him when the last time he'd seen his doctor for an appointment was, and he actually was confused about this question. He said that he didn't think that doctors saw their patients anymore. So this was a bit of a red flag to me because we are sending so many prescription renewal requests now. I get so many phone calls every day just asking for me to send a request to their doctor for the prescription, which is no problem. I mean, a lot of doctors respond to these requests. So I recommended that he make an appointment at his doctor's office, which would both benefit him and the doctor's office practice, because for him, he would be getting the prescription renewed with additional refills, and the doctor's office would be able to bill for the service that they're providing. Upon looking into this a little bit more, I've seen that, as far as I can tell, doctors' offices are not able to bill for prescription renewals if they don't see the patient in person. They are not able to charge the insurance company. Therefore, they are actually, it seems to me like they're losing money by not requiring an office visit, which overall, I understand that prescription refills don't always require a doctor's appointment, but in many cases, the use of these prescription medications does require some follow-up on a regular scheduled basis, once a year. And that's just to follow up on their vitals. Is their blood pressure within their goal range? Is their heart rate normal? How is their weight? Is there anything else going on? Is the medication still having the intended effect? Not all health concerns can be managed remotely. Yet, even when I try to call a doctor's office on a patient's behalf, their recording tree will often say, if you're calling for a prescription refill request, please contact your pharmacy. But I just have my reservations about doctors not seeing their patients when they're providing them prescription products. The whole point of something being a prescription is that it's not generally considered safe for the public to use. So it's a safety mechanism for it to be prescription only. Last week, I even had a patient who called and asked us to submit a prescription renewal request for tramadol, which is an opioid controlled substance. It is a C4, so therefore refills are allowed on it. But in general, there are limits on the refills. So refills cannot exceed a 120-day supply. And when the prescription renewal was responded to, the doctor did send in an additional tramadol prescription without seeing the patient. And in the prescriber notes, it had said, please tell patient to make an appointment for further refills. Last time patient was seen was in 2021. It had literally been 2 full years since this doctor had seen this patient. And prior to COVID, the law would not have allowed this. So the law would require the patient to see the doctor in person for a controlled substance prescription. One of the most dramatic shifts we saw during the coronavirus pandemic was the shift to telehealth prescribing, and the DEA relaxed some of the laws regarding the prescribing of controlled substances during the COVID pandemic as well, including that an in-person evaluation is no longer required. However, this is temporary. The DEA had originally planned on tightening up the prescribing of controlled substances away from telemedicine in May. However, like many things during COVID, this got extended, and now we are looking at a November timeframe for the elimination of telemedicine prescribing of controlled substances without an in-person evaluation. But really, this isn't just supposed to be about controlled substances. This is about any prescription. So if you're having trouble getting your prescription renewed, just make an appointment at your doctor's office. If you haven't seen your doctor in 2 years, make an appointment. And during that appointment, plan on asking them questions about how many refills they're allowed. Do they respond to prescription renewals? Is that what they would prefer? Would they prefer an annual office visit? Every doctor is going to be different. Every practice is going to have different priorities about prescription renewal requests. And I practice in a very busy area. I think there's a lot of difficulty in getting a doctor's appointment. Some people call and they can't get an appointment for many months. I mean, it's common. It happens all the time. So the prescription renewal function is absolutely essential, especially in these cases where patients can't get an appointment and their appointment is literally just for prescription renewal for something that they've been on for, it could be years. So many patients, they absolutely despise the thought of making a doctor's appointment and having to pay a copay for a prescription that has been the same for them for however long. But I personally see this as part of the doctor's responsibilities to check in on the patient and document that the patient is meeting their medical goals. So if you have any more insight into what the best way to go about the increased demand for prescription renewals, I'd love to hear it. But I know part of the problem is just supply and demand. I mean, there's so many people requesting these prescription refills. They're calling us, we're submitting a request to the doctor's office. They're calling the doctor's office. So the doctor's office has to check those messages, and then they've also got to look at our prescription refill requests. It's a lot of basic busy work that they have to process, and it takes time, it takes staffing, and therefore it takes money to be able to respond to these requests. And many times it's just easier for them to respond to a prescription refill request and just refill the medication for the patient. But there are definitely situations where this is not the most appropriate or the best response. So it's a complicated situation, but depending on the last time you saw your doctor, I think the best way to get your prescription renewed is to see your doctor. And I know it might sound kind of taboo to be talking about your doctor's office as a business, but that's exactly what it is. They can't keep their doors open unless they make money to pay their employees. So it's just gotta come full circle. They are providing a service, and the service is meant to be paid for either by your insurance or by you. However, insurance does not allow doctors to bill them for prescription renewal requests. So say they get 20 prescription renewal requests from all of their patients per day, and each of those requests theoretically takes 15 to 20 minutes. Well, 20 prescription requests times 20 minutes, that's 400 minutes. So That's over 6 hours of work. And I don't see how it's sustainable for a practice to be doing 6 hours of work for free when the patient is, and I know this sounds chaste, but the patient's benefiting, so therefore, as part of the doctor-patient relationship, the doctor's office should also be gaining a benefit. I know it doesn't sound great, but in reality, you can't just neglect the fact that doctors' offices are a business. And I know everyone won't agree with this. This is just part of the conclusion that I've come to dealing with these requests by the hundreds on a daily basis. So thank you for listening.